In recent months, the Trump administration has brought unprecedented policy changes and blunt cuts to U.S. federal spending and the federal workforce, creating grave dangers to health. In this environment, physicians can play a key role in defending the health of patients and communities. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Alice Chen, a primary care internist in Washington, D.C., and former executive director of Doctors for America. Dr. Chen has co-authored a perspective article about the power of physicians amid threats to common values. Dr. Chen, what were some of the challenges facing the medical profession and undermining physician morale even before these recent policy changes?
We have seen multiple threats to health even before these current federal policy changes. We have a healthcare system that has focused increasingly on profits and on paperwork in a way that physicians have felt like they are cogs in a wheel, that they are not being valued as the profession that we are, not being valued for the physician-patient relationship that is so central to healing. And we've also seen a societal underinvestment in all of the root causes of disease that are causing so many of our patients to have diabetes, heart disease, cancers, things that we ought to be able to prevent when they are preventable, that we're not investing enough in societal prevention. And then, of course, we are still coming out of the years of being in the pandemic, which was such a blow to the medical profession. It was such a struggle for so many. And then to come out of all of that into this new environment where so many federal policy changes are happening, it is certainly a big challenge.
And so, can you talk about these new policies and funding cuts? In what ways are they threatening health and the values of the medical community?
We are really seeing an unprecedented time of federal policy changes, and it's in federal policy, it's in funding, and it is in the federal health workforce. And we are seeing health being squeezed on so many different levels. We are seeing cuts to medical research on really important issues like cancer, Alzheimer's, diabetes, heart disease, issues that we deal with every day with our patients, where we're looking and searching for better treatments and better prevention. We've seen medical research studies that have been put in jeopardy. We are seeing the threat of very large cuts to Medicaid on the horizon as Congress has passed a joint budget resolution calling for $880 billion to be cut by the committee that oversees health, which effectively means that there would be large cuts to Medicaid across the country, and that would come out of people being able to get the care that they need. We are seeing chronic disease prevention being cut. We are seeing disease outbreak teams being cut entirely. In the middle of a measles outbreak, we are seeing the federal government saying, okay, there's a measles outbreak, but what we really want to do is divert staff to rehash already debunked claims on measles and autism. And so we are really seeing there is threat on multiple fronts to our medical and public health infrastructure.
You say in your perspective article that the history of the medical profession tells us that advocating for those in harm's way can have a meaningful effect on people's lives. So, what are some examples of physician advocacy that led to social change? And actually, have there been times when the lack of advocacy by physicians resulted in harm?
We have seen multiple times throughout history where physicians have played an important role. We saw it during the civil rights era in the summer of 1964, during the Freedom Summer in Mississippi, when volunteers went to register people to vote. Medical volunteers from the Medical Committee for Human Rights went to Mississippi. There are about 100 people who went and treated demonstrators who had been harmed and documented the disparities that were happening in care in the South and helped usher forward the Civil Rights Act and really a watershed time in our country's history when people thought nothing will ever change. We saw similarly when it came to nuclear weapons that folks were saying, hey, it's fine to be testing nuclear weapons. It's not that dangerous to people. And the Physicians for Social Responsibility stepped up and showed the public how damaging nuclear could be to people's health and helped usher forward the Nuclear Nonproliferation Treaty. And then in more recent years, with Medicaid expansion, we have had physicians in states across the country, across the political spectrum, who have worked hand in hand with patients and communities to win Medicaid expansion in states like Indiana and Oklahoma and Utah. And that has resulted in very significant health improvements for people who have been able to get onto expanded Medicaid. So we certainly have many examples of where physicians have stepped up and have done the right thing. We've also had experiences in the past where physicians have said, no, we don't want change. And that has tampered efforts to expand healthcare access. For example, in the 1990s, when there was a big push for federal healthcare reform, there were physicians who were saying, no, we don't want to expand healthcare to everybody. And that had a detrimental effect on efforts to expand care. So we know that medical professionals have a very important voice in society, and that when we use that voice to help improve people's health, we can really create important changes.
So, in the current environment, what role can physicians play in supporting health and responding to ongoing threats, both at the level of individual patient care and in their broader communities?
So we've heard this question from colleagues around the country of what can I do? Can I actually do anything that will make a difference? And the answer is there are absolutely things that we can do, even when you're looking at all of the headlines and it can feel like there's nothing to be done. That is actually part of the point of creating so much change all at once, is to overwhelm people. But physicians can really impact what's happening right now on multiple levels, starting with the patient in front of us. When we're in clinic with the patient or in the hospital with the patient, we are, as the responsible physician, we have the power to help understand what their needs are and to help go through the resources available and pull rabbits out of hats, as we often do in medicine, and help people get the care that they need and the help that they need. And that is incredibly important because we are seeing pullbacks on the social safety net, whether that is from food stamps to housing to all of the different resources people need to be healthy. So certainly starting with that patient in front of us and recognizing that at its core is always our most important responsibility. Another piece is stepping outside of our clinics and our hospitals is really speaking up with policymakers. The changes that are happening right now are so fast and furious that we have heard from policymakers who are saying we're not really sure where our constituents stand on these changes or really what the impacts are. And so as physicians, we have an incredibly important perspective because we see patients every day and we see different types of patients and different types of situations every day. And so we can really bring our voices, bring our stories of our patients to policymakers at the federal, state, and local levels to help them understand what is happening with people and to help them understand that we are watching, that people are paying attention, and that their actions have profound impacts and that they will be held accountable for those impacts. And then another piece is to speak up with the public, because the public is also feeling a lot of confusion and there's a lot of partisan rhetoric going around in the media. So speaking up with the public about the actual health impacts of policies and having conversations with our communities about what needs to change, what needs to stay the same, what are the ways that we need to improve the health of our communities. And as part of that, there are always things that we can do in our own communities that don't rely necessarily on federal funding or federal policy that can help our own communities that may be in distress during these times. So these are important things that individual physicians can do. And then our medical institutions have also a very important role to play here, because our medical institutions, whether those are medical societies or hospitals or other organizations in healthcare, have a voice that we need to be using to really call out the greatest threats to health right now and to be forceful in standing up for our patients.
How do you respond to physicians who are afraid of the potential ramifications of engaging in this sort of advocacy, including being targeted themselves?
That is certainly a fear that a lot of people have right now, not only physicians, but people across the board. And one of the most important things that we can do as a profession is to band together, is to work together, to all speak together with one voice. Not necessarily that we're all saying the exact same thing, but that we are standing shoulder to shoulder, that we are supporting one another and speaking up. There is always safety and power in numbers. And so that is a piece that is incredibly important. And then the other piece is that it is so important as physicians, especially in this very divisive and hyperpartisan environment that we're in right now, is for us as physicians, as professionals, to really focus in on our core, which is health, which is our patients, and really focus in on the actual impacts, the actual people who are being affected by policies, and make sure that everything that we are doing is around wanting to improve health, wanting to protect health, as opposed to having some particular partisan point of view. And of course, institutions here have a very important role to play because when institutions stand up, they give individual physicians more power and more cover to be able to speak up as well.
Finally, what gives you hope in the face of threats to medicine's moral code and to common values? What are you looking to?
I look to my colleagues in medicine. Every single day, I see people going above and beyond, putting their hearts and their souls into the care of their patients and really loving their patients and loving their colleagues. And when I see that, when I see the way physicians act on the day-to-day basis when they're far away from the headlines and nobody's giving them accolades, but really just doing the core work of the profession, it gives me hope. It gives me hope when we see patients the way they light up, when they see a physician who is really taking care of them, the way they express gratitude, when they say, "You have saved my life, you have impacted my life so much in the life of my family." That is the core of our profession. And it gets so distorted sometimes by everything else, by the bureaucracy, by profits, by politics, and everything else. But at its core, what we do day in and day out, the struggles we go through to take care of our patients and the rewards that we get in doing that work, that is what gives me hope.
Thank you, Dr. Chen.